useful and very helpful. So thanks for doing
Yes.
that.
So I think, let me just do a quick introduction for everyone who doesn't know. My name is Irene, and I'm a principal dentist at K Dental Studios. And Maria is our lovely pediatric dentist who comes in just to see children. And she's amazing. We love having her. And the point of today's sort of webinar was to sort of talk about the bits that we're just not sure about as parents, or we think we know maybe, but Maria's here to give us more clarity on diet and hygiene. So over to you, Maria.
Well, I am Maria Kalkani, and I'm a specialist in children's dentistry. I've been a children's dentist for about 15 years. I work in private practice and I work in the NHS as well. And I only see children from 0 to 16, 18, and that's my specialty. And I have there my personal sort of blog and website, and obviously K Dental Studios, which are on Great Portland Street, and their website as well. So I've got that. And if we move on, there we go. So we're going to talk about baby teeth today, because that's obviously the age group this webinar is aiming for. It's 0 to 5, 6 is when children start getting their adult teeth. So baby teeth are not just milk teeth, they're really important. They are important because they help children to eat and chew and develop their speech and language, and obviously hold the space for the permanent teeth, which is really important. And if we look after them and we start early, then we can prevent any problems from happening, which also means that we don't need any dental treatment or any problems to be solved in the future. So overall, we have 20 baby teeth. So we have 10 at the top and 10 at the bottom. And they come through gradually. They start developing quite early. So they start developing during pregnancy, and during the, from the 6th week of pregnancy, they start forming. So very early. And this is important because when sometimes we see issues with baby teeth, when we do their first assessment, for example, when we see them for the first checkup, usually before the first birthday, what we want to see is sometimes if the teeth have formed properly. And the most frequent question that I hear is, oh, is it because they're not getting, for example, enough milk, enough calcium, what have you? But these teeth have already formed. So when we see them in the mouth when they are 6 months, a year, 2 years old, what we see is the result of something that has happened during pregnancy. Just to remember that it's not, they do develop quite early, and that's why it's important when we get the advice from our doctors is to make sure that we do get enough vitamin D and all the supplements that we take during pregnancy. And then by the 3rd, 4th month of pregnancy, the dentin and enamel, which are the layers of the tooth that you see in the mouth, they have formed. At birth, all 20 teeth, as we said, they're already there, and they're waiting to come through. So they've already formed. Any developmental issues have already happened, if anything. So they're there and they're waiting for us to kind of check them when they come through. So again, there is no, black or white, but generally speaking, we say that they start teething from about 5 to 6 months. Now, I have had babies that they start teething at, month 3, and I've had babies that haven't had their first teeth until, month 9, 10. That's all normal. It's still within the normal range. So there's not necessarily something to worry about. If it's getting too delayed, it's good to have some things checked, just in case we're missing some teeth or something else is going on. But generally speaking, as long as the order of teeth coming through is correct, then I wouldn't worry too much about it. So we want usually the bottom front teeth and the front top teeth to come through first. It's unlikely that teeth at the back will come first. So, as long as the order and the sequence of growing is correct, whether, a baby starts teething at, 4 months or at, 10 months, is not necessarily, a bad thing. It's just how they grow. So there's a range, but usually on average, 5th, 6th month, that's when we see the first teeth come through. And again, we say we need to have 20 baby teeth, and we're going to be patient. They will come in groups, and the teething usually finishes by the third birthday. So the last 4 baby molars, so the second baby molars at the back, come through between 2.5 and 3 years of age. And that's when you stop with the teething for a while until you go back to, 5th birthday, 6th birthday, then you start getting the adult teeth in. So this is the usual sort of, the normal sequence of growing. And again, when we have teething, we have signs and symptoms like drooling and chewing on everything that comes anywhere near the mouth. We're quite irritable and we can be fussy, rosy, swollen cheeks, really tender gums, and maybe some slightly elevated temperature, but it's not a fever. So teething doesn't cause like a full-on fever. That's probably something else going on. But you can get some temperature, like, a bit of a warm cheeks and mouth and head. Again, things that help with teething. Every baby is different. Every toddler is different. Some toddlers and babies are really lucky. They don't get much of this and they're quite comfortable. The majority of them will get some symptoms that can be quite frustrating for them. If you're asking me, I think the best thing that works is Calpol, because it's brilliant and it's basically something that is hurting them. So you need to, if it's really affecting how they sleep and how you guys sleep at home, or how they eat, I think there's nothing wrong with giving some Calpol for that. Again, other things that I would recommend, something cold, something cooling in the mouth. These teethers that you can put in the fridge, please don't put them in the freezer. They can actually cause burns. So something cool, but not frozen. And I'm not an advocate for the little teething gels you can buy with any anesthetic in them. They don't really work. They end up swallowing all of it. So I don't think it really works. But any kind of remedy that you can rub on the gums that doesn't have any medicine in it, then you can try. But to be honest with you, I think Calpol and cooling stuff really are the things that work. And it's really important, the moment we see that front tooth coming through, the moment the tooth comes through, we have to start brushing it. Now, you don't want to brush for 2 minutes. That's not, we're just going to take a few seconds to brush the teeth. And you can either use a little finger brush like the one I've shown here, or you can have a little cloth that you can buy in the pharmacy. And again, you can clean the milk off the teeth when they come through. And then as you're getting more teeth, you can use a sort of a toothbrush with a small head that you can use. I don't know if I can show this here. I don't know if you can. Yes, you can see. So this is a very small-headed toothbrush that you can see. And I put here for 6 months to 3 years, we only put a smear of a toothpaste. And I'm just going to put a smear of a toothpaste here just to make it very clear how little toothpaste we actually put on the toothbrush. So I'm going to put it here. It's not even a blob. So it's just a tiniest bit. I don't know if it's visible there. I'm trying, but
it's visible.
Yeah, you can see that. So it's really important that it's very, very, very little. You want the fluoride in the toothpaste, then we have the guidelines that we have in this country, considering that we don't really have any fluoride in the water, except specific areas in the UK, like Birmingham or I think Southampton or Newcastle, but it depends on where you are in the country. But if we don't have any other source of fluoride, we need fluoride in the toothpaste to protect the teeth. And you just need a smear, so a tiny amount, and 1,000 parts per million of fluoride. All the mainstream toothpaste you can buy in the supermarket, in pharmacies, anywhere, 0 to 2, any brand, they have the right amount of fluoride. Even like, Boots' own brand or Tesco's own brand, they have the right amount of fluoride. I discourage my patients going to, pharmacies with very expensive organic sort of toothpaste, because the majority of them don't have any fluoride. So basically they don't do anything. They're very costly and they don't do anything. So you're just wasting your money basically. So you might as well use none at all. But the only benefit from the toothpaste is the fluoride, is the brushing that removes the plaque, is the actual physical cleaning that removes the food and the plaque. But then it's the fluoride that protects the enamel of the teeth. And then when we are over 3, again, the national guidelines say to increase the fluoride, get pretty much an adult strength toothpaste, which is 1,001 to 1,450 parts per million fluoride. So again, any Colgate Aquafresh, any brand from 3+, whether they group them in 3 to 5, 6+, 12+, they're all exactly the same thing. Maybe the flavors might change, or maybe some, they claim that the mint is a bit milder, but all of them are exactly the same. So to be honest, if you don't have an under 3-year-old, you can just have one toothpaste at home. You don't need 15 different toothpastes. You can do if you have a fussy toddler that doesn't like the taste, but it's not clinically, there's no difference at all. So you can use one toothpaste. And the really important thing here is that a 3-year-old or a 5-year-old or even a 6-year-old cannot brush by themselves. So this is bad news for parents, which means that you still need to brush the children's teeth until, well into their 6th birthday. You can let them practice, and you can let a 3-year-old practice and take the toothbrush without any toothpaste and just play a little bit first. But they don't have the dexterity or the coordination to brush efficiently. So you can't, say, oh, my 4-year-old brush by themselves, because they do put a brush in the mouth, but they don't actually brush. So especially at night time, when usually we have a little bit more time after a bath or whatever the routine might be, just do the brushing. It will not take you 2 minutes for a parent to brush a 3-year-old's teeth. It will be a lot quicker. And as Reina was saying earlier, sometimes it's a breeze, but sometimes a battle, and that's very normal. And it's very normal to hold a child down to brush teeth if they're not having it. You're doing it for their own benefit. You're not hurting anybody. And I've seen this video. It's been quite popular on social media. There was a dentist parent in the States that actually were brushing their very young toddler's teeth in the lab, but basically they had them, in the lab with the legs over the body, holding them down and brushing. And there were some people saying, well, that's, child abuse. No, it's not actually, because I'm sure this parent has had enough, and they're dentists, they know what they're doing. But it's the only way sometimes to stick a brush in the mouth and do, clean their teeth, because if you don't clean their teeth, then they're going to get cavities. And for me, that's when neglect starts happening. It's not if you're actually pushing for a brushing. So just to reassure parents, it's very normal to go through phases that, they absolutely fight and hate toothbrushing, and that's absolutely fine, but you will still have to do that. And you're not traumatizing anybody. You're doing them a favor. So please don't feel bad. I find sometimes in the mirror, it's good because they copy. As Raina was saying, it's good that, you can watch mommy do it and I go over and do it. Sometimes this might not help. If you feel that you're getting resistance, it's easier to do this when the kids are lying down. So whether it's lying down in bed, you don't have to brush the teeth in the bathroom. You can lie down on the carpet, because you have better access. So when you have the child's head on your lap, you actually hold, and this is a technique that I use at the practice as well. So when I'm checking a toddler's teeth, if they don't lie by themselves, I will have them on mum's and my lap. So it's easier for me to look and check and be a bit more efficient. So that's another kind of tip. If you feel that, you've hit a wall with standing in front of the mirror and you're fighting, that's something that I would recommend. With regards to spitting and swallowing, the reason we give these instructions about the fluoride level and how much toothpaste we give is because it's absolutely safe. And it's safe for this whole amount to be swallowed. It's not all swallowed. It stays in the environment of the mouth. It stays in the saliva, but some of it will be swallowed. That's why we say only a smear. That's why I've shown how much a smear is very little. And this is absolutely safe for the child to swallow or have it in their mouth. You don't expect a 3-year-old to spit, definitely not rinsing. We don't rinse anyway, but you don't expect them to do that. So you accept that, you give that recommendation with that in mind. So this is okay if they don't do that. Another little tip that I give, I tend to advise parents to use a dry toothbrush before they brush in the little ones, because it tends to froth less. If you have less froth, again, it sticks better more as a paste. than something like a frothy shampoo thing. And then again, less froth, less swallowing, less dilution, and more sticking to the teeth. That's another little tip. So you rinse after, but you don't rinse the brush before, so it's not wet. It's just a saliva, obviously, that dissolves the fluoride. So toothbrushing is one part, which is really, really important. But I think, and there's evidence out there, and there's dentists, especially in pediatrics, debating this for years and years, which is the most important factor that keeps teeth healthy and prevents cavities and prevents problems. Is it the toothbrushing? Is it the diet? What is it? You'll find evidence on both sides. I think, well, it's a combination of both. And there is obviously another factor that is, every organism, every child is different, every host is different. So the way I might develop cavities might be completely different with, the pace and the rate Irene will develop cavities, because our teeth are different, because the saliva is different, and the bacteria that we have in our mouths are different. So we don't compare siblings, we don't compare patients, everybody's different, but this is what we're aiming for. We're aiming for a very efficient parent-led toothbrushing and cleaning teeth with fluoride toothpaste twice a day, and healthy snacks during the day. When they're very little, obviously, I think parents are much more clued up nowadays, and when they're really little, they don't offer sugars freely, but then again, they start going to nursery, they start going, to parties and everything else, and I think sugary snacks become a bit more available. The advice generally is try not to give anything sugary in between the meals. So as a snack, it's absolutely fine to have some dessert. It's absolutely fine to have some ice cream. But when we're snacking in between our meals, so breakfast, lunch, dinner, we need to be very mindful of what these snacks are, because it's the frequency of these sugars that increase the risk of getting cavities in the mouth. So we obviously offer water and milk. We don't offer juice, when we're out and about. We can have some water if we're thirsty. If we want to give some juice, we can give it with breakfast. That's absolutely fine. But don't go and get a carton of any smoothie, innocent, what have you, that's full of sugar. We don't offer it as a snack, not during the day. Have it with your dinner if you want to give it, that's fine. It's the safest way, but not as a snack. So in between meals should be water or milk. And then, fresh fruit, whole fruit, vegetables. Cheese is brilliant. Any kind of cheese. It doesn't have to be fancy cheese that they don't like. It can be cheese strings. I know it's not the best quality cheese, but it is fine. It has calcium and it is safer. Crackers, any crackers, plain yogurt. Obviously, we're staying away from things like, I don't know, I only know the brand like Petit Filou or anything like that, because they're full of sugar. Any children's yogurt pots, if you look at the ingredients, they're full of sugar. Any plain Greek yogurt, chop up some fruit in there, leave it there. You can mix it up. I think they're absolutely fine in the fridge for 3 days. Put them in a little pot, seal them. They're fine for 3 days. They're absolutely safe. And chop up some strawberries, some blueberries, whatever they eat, some bananas, apples, anything they like. Mix them up and have them there. Obviously, we don't add honeys and things like that, because again, that's free sugars. But any fruit in its whole, whether it's chopped up but not mushed and not juiced, has the fiber in the molecule. So it makes the breakdown of the free sugars a lot harder. So it's safer for the teeth for that reason. So any fresh fruit, you pick it, whatever they like, mix it up. And any vegetables, cucumbers, carrot sticks, tomatoes, anything they might like, mix them up, chop them up, put them in the fridge and just in a Tupperware, and then give them to them. Again, if you don't offer different things, that's what they learn. And they're not, you don't have to be buying things, from the supermarket all the time. So I think it's worth chopping up some stuff, putting in the fridge. They do last, so have them then, give them to them. I know Irene, that's what she would do. So
I think this is like a sore point, because I see parents just handing out snacks at the gate of the school, or and they're always in a packet, and you always think if they're in a packet, they're going to have sugar in them. So yes, thank you for clarifying.
But there will be times that, you went somewhere, we went to the museum or what have you, and maybe, it's okay, but not on a daily basis. There will be the odd, day that it's impossible, and that's fine, but this is not the norm. This is not what we normally offer. And when we leave home, we should have something which is not expensive, and it's not, we can do that. It doesn't take that long to make. And again, avoid any sticky, sugary things as a snack. Anything, that there is no things like yo-yo bears and stuff like that. I mean, I wish I have been through the ingredients of yo-yo bears. It's just sugar. It's just sugar, and they are marketed for children. And this, I mean, it's been a debate in this country for so many years now. But now again, with the ultra processed foods, it becomes back into the conversation, which is brilliant. But all these things that are marketed for kids and you buy them in the store, just have a look at the back. See where carbohydrate-free sugars are listed. And if it's in the first like 3-5 ingredients, this is what it is. So it's nothing healthy about them. And let's not offer them. Again, if it needs to be, if it's been given to them or, what have you, save them, have them at meal times, because that's the safest time to have it. Remember, it's the frequency of, the acid attacks and the sugary attacks that we give to our mouth, not how much we have. So limit those to meal times. That's the safest way of having them. So again, if they have their meal, they're full. Again, obviously if they're active, they're a bit older when they're toddlers and they need something, but generally avoid snacking. Constant snacking is the key there to protect the teeth. And if we have to snack, let's opt for something that is, comes from the tree, comes from it doesn't come from a packet, basically. And do introduce things like as a cheese. I know you can't have them in most schools, like nut butters. But if your child's not allergic and you don't give them to school, but when they come home, they can have peanut butter, they can have on toast, they can have almond butter, they can add butter to, cracker. So it's a bit more fat and protein. So it fills them up a bit more. You can have cream cheese, you can have little, crackers and cream cheese, or, you can have hummus if they like hummus. But it's just these things that they're simple and they are actually filling and they're quite healthy for them. So that's what I would usually recommend. So it goes through like more like visuals of that. So another thing that I need to highlight is those dried fruit packages and the little boxes. This is a pain of my life. As a child, I was force-fed raisins and I absolutely hated them. But my mum thought they were brilliant and I should have them. I hate raisins. But they're not healthy. They're not good for you, for your teeth, or they're pure sugar because you remove the water content of the fruit. So that increases the concentration of sugar a lot. Obviously, nutritionists might say, well, they have fiber. Fine, then have them with your porridge in the morning. Give them with a porridge, give them with a yogurt. So give them with a meal, that, with a breakfast if you can. But snacking on raisins or dried apricots or dried anything, dried mangoes, they are very, for the teeth, it's the same as toffee. It's not for your gut, but it is for the teeth. So it's the same as toffee. So if you be clever when you add them, if you want to give them for that reason, but always be mindful that this is toffee for the teeth, so not as a snack. So let me just go there. So that's yeah. So again, why a pediatric dentist? So just a little bit about why I do what I do and why I do recommend, if you have the option, to see with your toddler a pediatric dentist. That would be because I and all the pediatric dentists that we work in this country, we have been through extensive training and we specialize in just treating children. So as in my practice limited children, I don't see anyone over 18. And I haven't had for 15 years. So we have training in how to approach children, in how to detect things early, how to change things and how to improve things, but also how to approach younger children and how to make it fun, but make it also quite useful for them. We have different tools that we can use. We have a lot of behavior management techniques that we have been taught and have been using for years. And we do operate in very little mouths in a very short window of time that we have to do, because their threshold is like maximum 20 minutes, 30 minutes. You can't keep a toddler in the chair for longer than that, as Irene would know. it's a different approach. It's a different treatment in a way. And we do have other things if we need to. So if we have any trauma, we have other, situations that are a bit more urgent, we deal with them in a kind of safe way. And we have other things that we can use, like sedation or general anesthetic, when it comes to more complex situations, when it comes to, we've done all that, but things might still go wrong and we need to treat. So that's the difference. So we have extensive training, and our practice is, limited to children, because children for us are not little adults. So we don't say, oh, just jump in the chair, I'll see you for 2 seconds, then you can go. It does take a long time to have this conversation with the parents and do like a thorough examination as well. So what I recommend is first visit by first birthday. That has been a very good campaign from the British Society of Paediatric Dentistry, and also from the government. One thing they've done well, the government, not British Society of Paediatric Dentistry, are really good. They push for the first checkup to be early. So when the tooth comes through, or by the first birthday, and you can have all these conversations, you can acclimatize a child, you can have these very lengthy chats with the parents, even with things about dummies and about other things that might happen. We'd put fluoride varnish with the treatment that we do at every checkup. And again, it's a way of acclimatizing the children. So, sitting down, being familiar with the environment when you don't need something. So when you don't need treatment, when you're not in pain, when you don't have an injury. So at least you can have this calm environment that you can acclimatize with the tools that they're using, with the mirror, with sitting in the chair. And it's fine if you sit on a parent's lap for the first couple of times. But it builds up their confidence, because they do want to help you, they do want to be part of this, but obviously it's quite scary sometimes, especially when they come in and they just had an injury or they have pain. It makes life a lot harder. So the sooner you get them in the pediatric dentist in this environment, the better for them, for their future sort of relationship with the dentist and the dental environment. And again, what we do, as I said, we do things, we check the bite, we check how the development is. If the enamel is correct, we have any hypoplastic enamel. If the shape of the teeth, if the number of the teeth is correct, and we advise accordingly. So I think it's really important. I think the message would be to do take them, not to, oh, well, we don't have any problems, we're not going to take the dentist, or, well, we only have like 5 teeth, what are we going to do? For me, this is the most important time, because then you have this conversation, and I don't think any parent becomes a parent knowing how to treat teeth. I certainly wouldn't, unless, I've been to dental school. You wouldn't know these things, so you're not expected to know all these things, but we're there and we can give that advice. And whoever watches this at any point, this is some free advice, and it's really important to highlight that.
I have to say
we
that
are here.
I have to say, Maria, that even me being a dentist and being through dental school and doing like a fraction of what you've done in training, I think you give the little tips that you wouldn't think about. So as a mother, you said something to me the other day, I was, oh, actually, yeah, I can do that. So it is really important, I think.
And sometimes the parents will get back to you, and all this experience and interaction I have, because maybe a parent told me something. I have a parent that I keep mentioning her, and now her daughter is still older, but she gave me something that she found in the States about stopping thumb sucking, which is, it really kind of, oh, that's a great idea. I mean, we don't have them here, but we can do something similar. So, we always, this interaction is always useful to be had, I think, as early as possible. That's what I would recommend.
Maria, there is now that you mentioned thumb sucking, there is Raimu who asked whether you have any some thumb sucking techniques, stopping, how to stop thumb sucking. Is that something that you want to discuss with them privately, or?
I think good, because it really depends on how often, and it's a difficult one with thumb sucking, but I would generally say, what I don't remember what age Raina's little one was. Was it 2 or how old?
2.5.
2.5. Okay. I think it's at this age you can't reason. So at 2.5, you can't really explain to them your teeth are going to look a certain way or your jaw is going to be damaged. So you can't say that. So the best way at this age is actually be very vigilant and be proactive. And if you see that's going in, try and take it out. So varnishes and stuff don't work with little ones. They don't. They just go. They bypass them. They're too young to have the little thumb guards that we use, because they will just take them out. So at this age, what we find is more of a reward and a distraction approach. And it is very important to start now, because it's not just the teeth. The teeth will change. The teeth will, it's mainly the palate that can change shape, that can get, distorted. And this is something that is hard to treat later. So my advice would be get on this. And I'm going to have like a kind of one-to-one chat about this. But the sooner you do that, the better.
Perfect. Thank you very much, Maria.
That's okay. It's a pleasure.
Any other questions from anyone?
So whoever obviously watches this, because I know you will have it available, there are emails here. So either email, I think best email the practice. And if there are any questions or anything, by all means, whenever you watch this, go ahead and ask. I think I'd rather you ask than ask Google. So,
yes, definitely.
I would feel a bit more confident that I can give it more personalized advice than Google or ChatGPT for that reason. I think please do. I'd rather you ask questions. And I have lots of people reach out to me on social and stuff like that. I don't know, they're not my patients, but I respect that they have this worry as a parent, and they want to ask a question, which is totally understandable.
Excellent. Thank you very much, Maria.
Brilliant. So I don't know if Nikki wants to ask anything. You don't have to ask something if you have something.
Well, like you said, they can always ask. Sending us an email. You can drop us an email, send us your details. We'll contact you. Otherwise, thank you very much, Maria, and
hopefully this will be useful. I'm certain
some more
useful.
Brilliant. Thank you. Thank you, everyone, for joining.
Everybody. Bye. Bye.
Thank you so much. Thank you.
Bye.
Bye.
Thanks, Maria.
Bye.